Hi there and welcome. Dr. Ben Latto O'Brien from the Natural Medicine and Nutrition Clinic in Subiaco, and I just want to do a quick little video on stenosis. A patient came in with this morning and it's a tricky thing to treat, I'll be honest, it's very difficult. Sometimes when it's really that bad, there is no option but to go and have surgery. You need to go and see a spinal surgeon. But you know, if you can't do that and you don't want to have surgery and you can't have cortisone, well, then what do? This particular patient doesn't want to have surgery. She's 88 and she's had 3 shots of cortisone and it hasn't done anything. So she tried that, it didn't work. Now she's come in to see me. I did get quite a good result with acupuncture with her, which was quite miraculous. I've only seen her today for the second time. So we'll see how she goes with that, but the signs look good early. Now let's talk about what stenosis is. What that means is that if you have calcium that builds up in and around your foramen of your neck or your mid-back or your lower back, you basically start to get turned to stone. And that's obviously not ideal. And that's what stenosis means. Let me just show you on a little model here. So here we have a model of the skeleton. And this is the back of the head. This is the vertebral column. Here you have the peripheral nerves that come out of the neck, out of the central nervous system. And this red thing here is just representing a blood vessel. So your nerves come out of your vertebra at the side here, and they pass through a hole, which in biology or anatomy is called a foramen. A foramen is just a fancy name for a passageway. So the nerve pushes through like this, and there should be plenty of gap. If there's not plenty of gap and calcium starts to build up around this edge, then this foramen gets smaller and smaller and smaller until it starts to pinch on the nerve. Then you have nerve symptoms, and nerve symptoms are things like tingling, burning, altered sensation, hot and cold sensation. When it gets really bad, it goes numb. That's when you know that you're in trouble with, could be electric as well. These are all nerve-related symptoms. So if you're having these symptoms, then we know that something is wrong with your nerve. And generally, people will know that. You diagnose this through medical investigation, Western medicine investigation. So this is a CT scan or an MRI. These are the ways that you diagnose stenosis accurately. So patients bring me their report of their MRI and then I can see, yes, this is stenosis. Now what are we going to do about it? If you don't want to have drugs and you don't want to have surgery, is there another option? And the answer is yes, there is. There is different things you can do. Acupuncture is very good at helping to treat the symptoms and relieve the pain. Depending on where the pain is, I know which nerve is influenced by the stenosis, and that's how you treat clinically with acupuncture, or how I treat clinically with acupuncture. There's a couple of nutrients that are really, really good to help break down the bad calcium in the body. And one of those is magnesium. Magnesium and calcium have the same metabolic pathway. So if you want to lessen the effect of one, you take the other one. So megadosing on magnesium can be a very, very good way of starting to help the body break down the calcium. The other thing that I use clinically is a thing called MSM, methyl sulfur methane. And MSM is basically sulfur capsules. And sulfur is really, really important for connective tissue function, and it's an anti-inflammatory, and it helps joint soreness and all that kind of thing, but it also helps break down the calcium in the body and get rid of it. The body's put the calcium there for some reason, so no one really knows why. I don't know why. I have my suspicions. Some people I see with stenosis are because they've been on calcium supplements for many, many years, and unfortunately they've ended up calcified. They're starting to turn to stone. You can also get calcium in different parts of the body, not just in the spine. It can be in the hip or the knee or the shoulder or in tendons or wherever, which is obviously not ideal. So I don't use calcium supplements for that reason. There's different ways that I will help people recalcify their bones, but prescribing calcium is not one of those. I don't think so anyway, that's my opinion. So acupuncture is very good for helping the symptoms. You've got an internal problem, though, you need internal medicine. You need something to get in there and break this down from the inside. That just kind of makes sense, yeah? That's the right protocol to take. So the combination of magnesium, MSM, acupuncture, these are the 3 things that I use in the clinic to help patients with stenosis and start to see the results reversed. Which is amazing, because maybe you don't want to have drugs and surgery, or maybe that isn't an option for you for whatever reasons, but just know there is other things that you can do. So hopefully that makes some sense. And if you want to learn a little bit more about what I do at the clinic and whether I can help you or not, Dr. Ben Latto O'Brien, Doctor of Chinese Medicine and Nutrition, and I'm in Churchill Court at the Natural Medicine and Nutrition Clinic. Hopefully this helps. Any comments or questions, let me know.